Hi everybody, I'm Dr. Ali Kareen. I've been doing integrative holistic pediatric medicine for a long time now, 25 years. And anyone who knows me knows that I am oftentimes in the middle of maybe opposing views of things that are very strongly felt. I've followed politics and regulatory capture and other topics that affect medical care for a really long time. And I want to help some of you walk through that with us as we go through this changing times that are happening fast with the MAHA movement. Sometimes I'm going to agree, sometimes I'm not. And so I thought I'd help today, since we're just getting started with some of the executive orders coming out of the MAHA movement, with giving you some insight on that. First of all, if you're wondering what regulatory capture means and how it affects your healthcare and policy at the governmental level, I really recommend you listening to the podcast with Joe Rogan and Callie Means. They really discussed the notion of how corporations and players affect policy at the federal level in the best interest of people with money and not always in the best interest of our patients. A lot of us know we're miserable in healthcare and we're not really sure why. It's tempting to maybe get really dramatic about that, and maybe somewhere in the middle is the appropriate response. I've been following Twitter quite a bit, and there's a lot of uproar about the executive order signed yesterday by President Trump about the creation of the MAHA committee and the effect it will have on pediatric psychiatric medicines. I prescribe a lot of medicines in my practice. I also use diet and supplements and therapies to help patients, and I really think that all of those things should be available to us, but we need to be cautious about how we use them and be diligent in their use. And so, like a lot of things, I think there's good and there's bad here, but let's just clear up some things about the EO specifically to kind of help you navigate the news, which can sometimes describe it maybe more dramatically than it needs to be. It's broken up into several parts. The first part is called the proposal and the purpose of it, which is basically outlines some of the things, if you've been following this topic, that we've been discussing in the national narrative, which is 40% of American children are now diagnosed with a chronic disease, and 1 in 36 children are now diagnosed with autism. I see this in my practice every day. I have lots of opinions about why we are sicker as a country, and I'll save those for videos at another time. Section 2 talks a lot about transparency and limiting conflicts of interests, trying to get to root causes, working with our farmers, and then also it discusses the idea of having insurance coverage for more preventative style things than only sickness care. That one's going to be tough. We'll see how that plays out. Number 3 is the definition of the commission, who will be on it. Number 4 is that they're studying causes of disease and advising both the president and Congress what to do about those. Section 5 is the one that's making the most news. I'll go through the less controversial ones first. They're going to compare our numbers and our outcomes to other countries, and you might be surprised how bad our outcomes in America really are. They're going to evaluate our education programs and whether they're actually helping to prevent disease in our children, including our physical education programs. They're going to look at transparency in research to see if we can remove some of the conflicts of interest that affect our research industry, and then they're going to gather data, and they're going to try to really be more transparent about how that data is collected. Section 5, number 3, is the one that's gotten the most headlines. And in it says that they will research the prevalence of and threat posed by the prescription of selective serotonin reuptake inhibitors, antipsychotics, mood stabilizers, stimulants, and weight loss drugs in regards to children. If you read the headlines, they say that Trump's going to take away everybody's Zoloft and it'll be terrible and everything will be awful. Obviously, if you read the wording of that, that's not what it says. It says they're going to research those topics. I will wait and see what they have to say. One of the things that I often think about when we're talking about policy and national level things is that you get these very dramatic pendulum swings where things go back and forth in the rhetoric around a topic. But oftentimes, you've got these two opposing forces, and somewhere in the middle there is compromise. And I really suspect that will be where we will land with this. There are far too many people in both the medical community and the pharmaceutical community and the community of people with disabilities who really need these medications that will ensure that they continue. And I'm sure there are lots of families in my practice even who got a little worried with the headlines. But there's nothing in this EO that says that we're taking away those medications. There's only discussion of should we be getting better data. I would actually agree we need better data. I utilize medicines in my practice, but I also know how little data we really have about what ages are appropriate, what specific symptoms. You can use a term like depression or anxiety, and what does that mean? Does that mean debilitating anxiety? Does that mean I'm scared to go to school because I don't like my teacher anxiety? And really getting a better idea of which of those patients are appropriate to be using medications, and maybe which of those patients we could use something else to help them with. I'm going to wait and see how this all plays out, and I hope you do too. I'll continue to make more posts and more videos as new things come out, and try to help you navigate along the way what we think is happening. Thanks.